Okay, thank you so much, everybody, for joining me today for this webinar. I am going to wait until 2 o'clock to get started, so I have about 2 minutes. But I just wanted to say that I'm really excited to give this webinar today. We had a lot of people register, including people whose work in the anti-trafficking field I have followed for quite a long time. So thank you all so much for coming in and attending this webinar. I'm really excited. Everybody is in listen only mode. I will have time for questions at the end. So if at any time you have questions, please go to the question box on your control panel and feel free to submit them at any time during the presentation, and I will get to them at the end. We have about 1 minute left, so we're going to wait just a little bit. But thank you all so much for joining me. Now, normally this training would take about 2 hours, but I'm going to try to get it in 50 minutes. So if during this presentation you feel like there are pieces missing, there are. Feel free to submit questions or email me after the presentation if you're interested in additional information. So it is now 2 o'clock by my watch, so let's go ahead and get started. Hi, everybody. My name is Sarah Jane Brewer, and I am the Education Specialist with United Against Human Trafficking. And today, this webinar is on human trafficking for first responders. That includes firefighters, emergency medical technicians, paramedics, and anybody who is in that intersection of disaster response and healthcare. Now, personally, I am not trained as a first responder, but I have had the opportunity to work alongside first responders in my past work, and I did a good number of research for this presentation. So let's go ahead and get started. So I want to talk a little bit about my organization, United Against Human Trafficking. So we are a Houston area organization that serves the greater Houston area. And my department, the education department, focuses on educating the community about what human trafficking is and how each person and each group can play a part in fighting this. We also have specific trainings for frontline professionals, such as this training, and we also train those in the healthcare field, social service providers, teachers, those in the hospitality industry, and a few others. We also lead a coalition called the Houston Rescue and Restore Coalition that has about 65 to 70 member organizations that all serve victims and survivors of human trafficking. Some do prevention education like we do, and there are others that provide direct services. And the coalition is a way for all of us to collaborate, share resources, share knowledge, and really unify our efforts to fight human trafficking. We also prevent exploitation through youth programs. We have an amazing youth team that reaches out to juvenile detention centers, middle schools, and high schools to talk to young people about not just human trafficking, but how they can protect themselves, what methods traffickers use, how to stay safe online, and how they can build the skills to be more resilient against exploitation. And we also do outreach to communities that are more vulnerable to human trafficking, such as homeless encampments, drug rehab facilities, group homes, and other places where people lack resources, and talk to them not only about human trafficking, but about the resources that are available to them so that they too can strengthen their resilience. And we also provide some direct services. We have support groups for families of survivors of trafficking, and we are in the midst of launching case management as well. So why first responders? Why engage you in this fight? So research has shown us that most survivors come into contact with some form of healthcare during their exploitation. However, only 6% of healthcare workers report treating somebody that they suspected was a victim of human trafficking. So what this data tells us is that most survivors come into the healthcare system, and it's likely that healthcare providers have the highest likelihood of any other profession of meaningful interaction with victims of human trafficking. But there is a significantly low rate of healthcare workers that feel confident in identifying and responding to patients that are being exploited, and we want to even those numbers out. So due to the really violent and chaotic nature of a lot of trafficking situations, victims frequently face life-threatening situations on a regular basis. So first responders might be the first and possibly the only contact that patients have outside of their situation. And so if first responders are able to engage with victims, identify them, then they have that opportunity to separate victims from their trafficker, record those signs and suspicions of trafficking, and connect that potential victim with resources. Now, I have been using the term victim, but I do want to clarify that someone who has been trafficked is not defined by their trafficking experience, and victim is used as a legal term and a law enforcement term. But as much as possible, it's really important for us to focus on people as individuals that are more than their trafficking situation. So what is human trafficking? And I know that there are a lot of people on this call who work in the anti-trafficking field and have seen this model before. But for those who may not be as familiar, so human trafficking was really clearly defined and made illegal for the first time through the Trafficking Victims Protection Act, which was enacted in 2000. And this was really the first piece of legislation that clearly defined what human trafficking is and set provisions for prosecution of traffickers and protection and resources for victims. And the United States was actually the first country to have this kind of legislation enacted. So we use the AMP model to illustrate the TVPA. That is an action by a means for a purpose is human trafficking. So the action is what they do to the person, right? The recruiting, the harboring, the transporting. Every few years, the TVPA is reauthorized and the definition is more clearly defined to suit the changing and evolving nature of human trafficking. So as human trafficking, as well as a lot of other things in our society, have moved online, the last iteration of the TVPA included the advertising and the soliciting. We see people who are advertising online, even though Backpage.com was shut down a few years ago, people are still advertising for sex and to buy sex on websites such as Craigslist. And the means, and by means we mean a means of establishing and maintaining control over a person. So force, fraud, or coercion. Force is like a direct physical violent form of establishing control. So it looks like physical assault, sexual assault, isolation, starvation, kidnapping, being chained up or physically held in bondage. And to be honest, we don't see this very frequently. This is the form that a lot of people see or a lot of people think of when they think of human trafficking. They see the movie Taken and they think that it looks like somebody getting snatched up and and kidnapped and drugged and forced to a bed. And that does happen, but that's just not the method that we see most frequently. What we see the most frequently are fraud and coercion. So fraud can look like a false romantic promise. So we see traffickers dating their victims, buying them gifts, convincing them that they are in love. And then once that love and trust is established, then the trafficker turns around and says, well, now you owe me, or I need you to do this for us, for our future. It can also look like a false job offer, so a job that either doesn't exist or is very different from what was promised. We also see coercion. So coercion is essentially this for that. It's threats, blackmail, the taking of IDs. We see traffickers, they get all of this information about their victims, and then they'll say, well, if you don't do what I say, I'm going to hurt your family, or I'm going to hurt your loved ones. And for those of us who haven't been trafficked, it's important for us to think, what would we do in order to protect the ones that we love when we're trying to understand how somebody came to be in this situation. It can also look like blackmail or the taking of IDs. What we see really frequently, especially in situations of foreign national victims of human trafficking, is there is that fraud element where they are promised a job in the United States. They'll pay for everything, they'll get all the paperwork in order, and once they start working, they'll be able to have a great life and send home, money home to their family. And then once they get here, the trafficker or recruiter then says, well, you owe me for transportation and for lodging and for food. So until you pay off this debt, you're not going to earn any money, or you're going to earn very little money. And so the person believes that they need to stay in this situation because they have this debt to pay off. But in reality, this is an illegal practice. And we refer to this as debt bondage or peonage. So the recruiter might say, you owe me this debt, or if you go to the police, then you'll be arrested, you'll be deported. Frequently, the recruiter or trafficker will take the identification papers of that person. So they really feel like they have to pay off this debt. They can't trust the police. They don't speak the language, and they can't trust anybody in this new country where they live. So that covers the means. And for the purpose of sexual exploitation or labor exploitation. So sexual exploitation is a commercial sex act. It can be a sex act or pornography or webcamming, recording of some kind. And it's that act in exchange for something of value. And value does not necessarily have to mean money. It can also mean a place to stay, safety, food, drugs, protection, anything that somebody deems valuable in that moment. And then labor exploitation is really any violation of labor rights. So it can look like working too many hours, working in unsafe conditions, not getting paid the right amount, having conditions of physical assault or sexual assault in the labor situation. And it's a lot harder to identify than sexual exploitation because it really depends on individuals knowing their labor rights. And us here in the United States, we're really not taught our labor rights. We have to learn from things happening and us having to look things up and look for resources. And for people who come from another country that might have very different labor laws, it's even more difficult to know that they are being exploited. So two things I want to point out about this definition. Nowhere in this does the word money appear. So a person can be paid and still be trafficked. We also don't see the word consent in here. Someone can consent to their trafficking. People a lot of times don't identify with being a victim or with being trafficked or being exploited. Because of that fraud and coercion aspect, they might believe this is their relationship, this is their job, this is their choice. Now, the exception to this rule is if somebody is under the age of 18, we do not need to prove force, fraud, or coercion to prove a case of human trafficking. If the person is under the age of 18 for the purpose of sexual exploitation. And the reason is that federally, the age of consent is 18. So anybody who is under the age of 18 doing a commercial sex act cannot legally consent to that act. So as long as we can prove the action, which as you can see is pretty broad, there's a lot of things that fit into that definition of an action, and a commercial sex act, and then that minor is automatically a victim of human trafficking. Now, I know that some states, including here in Texas, the age of consent is younger than 18. However, this is a federal law, so this applies all over the country. Now, unfortunately, we still see minors being arrested for prostitution, even though by the federal definition, they can't consent to prostitution or to their sexual exploitation. And that is why some states have also enacted safe harbor laws, which provides additional protection for minors being trafficked. Now, I spend a lot of time on this slide because there are some misconceptions about what human trafficking is. So I just want to really clearly define it. And each country has its own laws, but this is the law as it is in the United States. Now, I want to talk about numbers for a minute, and I want to preface this by saying that this is largely a hidden crime. Trafficking by its nature is hidden, and traffickers are constantly thinking of new ways to stay in the shadows. That being said, this study was done by the International Labor Organization, and they found that there are about 25 million victims of human trafficking globally, and that number jumps to 40 million if we include forced marriage. And to break that down further, they found that 55% of affected people were women and 45% were men. And I don't know that gender minorities were included in this study. And as far as age goes, 74% of victims were adults and 26% were children. So a lot of the media focus that we see on trafficking is women and children. But in research and service provision, we're seeing that there is almost equal gender split, but a lack of knowledge and resources and identification for men and for adults. So to break this down, here in Texas, the University of Texas at Austin estimated in 2016 that there are about 313,000 victims of trafficking here in Texas. And 79,000 of those are minor victims of sex trafficking, and 234,000 are victims of labor trafficking. So they weren't able to collect reliable data on adult victims of sex trafficking, so we're already missing a huge piece of this puzzle. Now, there are a few reasons that Texas is considered a hub for human trafficking. We are close to the border. There's a lot of big industries like construction, gas and oil, and agriculture that are easier for labor trafficking to exist because of the large scale of them, and also physically, those industries tend to be removed from the public eye. We have a lot of transportation here, seaports, airports, roadways. The I-10 travels from California to Texas, and the Department of Justice said that the I-10 is the most used road by human traffickers. However, on the flip side of this, Texas also has a really robust anti-trafficking network. We have the Houston the Human Trafficking Rescue Alliance, also known as H.E.A.R, which is made up of law enforcement, prosecutors, and social service organizations that really work towards the investigation and prosecution side of trafficking. And we also have the Mayor's Office on Human Trafficking, which is a special position created for the first time in Houston, and it's since been replicated in other places. And the special advisor to the mayor really focuses and institutionalizes the city of Houston's response to human trafficking. So Meenal Patel Davis is that special advisor, and she has researched and enacted such policies as billboards for public outreach, self-identification and the human trafficking hotline number in jails, and examining methods and contracts of procurement to make sure that labor trafficking is eliminated as much as possible. So for those of you outside of the Texas area who are looking for different ways that other cities and states are tackling this problem in a collaborative way, please send me an email and I will send you some more information on what we are doing here in Houston. Additionally, like I mentioned in the beginning, United Against Human Trafficking leads the Houston Rescue and Restore Coalition, which is made up of those social service organizations, as well as students and other members of the community, to collaborate our efforts to fight human trafficking. So next I want to talk about what it looks like within that, that victimization, right? So anybody can be trafficked, regardless of age, gender expression, socioeconomic class, race. However, there are some factors that cause somebody to be more vulnerable to being trafficked. So if somebody comes from a family background with violence, disruption, dysfunction, then they might come to normalize things like violence or abusive behavior, and might be really desperate for love and connection because they don't get that from their family. Additionally, if somebody runs away or is homeless, then it's a lot easier for traffickers to have access to them because they're looking for those basic needs to be met. And unfortunately, there is a lot of stigma and discrimination against those in the lesbian, gay, bisexual, transgender, queer plus community. And when those individuals are thrown out of their homes, then that person is really desperate for not just love, but basic necessities like a place to live, food. And traffickers look for people like that to prey on. Studies have shown that runaways or throwaways will, and I hate that term throwaway, but it's really for somebody who's been thrown out of their home. For people like that to be approached by a trafficker within 48 hours of running away from home. And some survivor stories, it happened within 15 minutes. So if somebody is involved in foster care or the juvenile justice system, if they already have experience with those institutional systems, then they are already at higher risk. It's harder for them to have support systems. It's harder for them to get jobs. As far as societal risk factors go, as we know, some communities, especially where there is a higher concentration of people of color or Native communities, there are a lack of resources and a lack of awareness of trafficking and what that looks like. We also have sexualization of youth in our culture, and that really drives the demand for the sex trafficking of minors, also known as CSEC, the commercial sexual exploitation of children. And in terms of communities, things like, in certain communities, things like sex and drugs and gang involvement can be normalized and even pressured. And if somebody comes from a family where, you know, their parents were involved in those industries, in prostitution or in drugs, then it's sort of expected for them to carry on the family business, essentially. So these are just some of the risk factors that cause certain people and populations to be more vulnerable to being trafficking. And it really comes from if somebody doesn't have love, support, and resources, then they are going to look to get those needs met elsewhere. So we get the question a lot, well, why don't they just leave? And there are a lot of reasons that somebody might be unable to leave that situation. That debt bondage that I spoke of when defining the TVPA, somebody believes that they have a debt to pay off, and the trafficker might tell them, if you don't pay off this debt, then I know where your family is back home, and something really bad is going to happen to them. And this fear of retaliation can happen even outside of a debt bondage situation. Some people, especially when it comes to sex trafficking, have a romantic involvement with their trafficker. They might be married, they might have kids, they might, this might be their boyfriend that they believe. And especially for somebody who doesn't recognize unhealthy relationships, it's a lot scarier for them to be away from that person, even if that person is threatening them and committing violence against them and forcing them to do things that they don't want to do. Now, when someone is trafficked, they undergo extreme trauma, and trauma does some interesting things to the brain, and that's a whole other conversation, and we'll talk about trauma a few times during this presentation. But one of the things that the brain does to protect itself in trauma is to form bonds with the people who are close to them in that trauma. So they may form trauma bonds with their trafficker or with the other people who are involved in that situation, and it's really hard to break that. Someone might be scared about being deported. This country is unfortunately not very kind to foreign nationals and refugee asylum seekers, and that's a very real fear that they have. Another really real fear is the mistrust of law enforcement. People who are foreign nationals or involved in sex trafficking might have really bad experiences with law enforcement, and it causes them to be mistrustful of them. And even if they come across law enforcement and they're being raped or assaulted or any of these other horrible things, it could be really hard for them to be able to trust law enforcement and reach out to them for help. They could have low self-esteem. They might not have completed school. They might perceive that they have a lack of job skills. They might not identify with being a victim or with human trafficking. And in a lot of situations, maybe this is the best they can do if they come from a situation where they don't have a lot of options, and this really seemed like their only option. Then it's difficult to be financially secure or see a future in which they will be financially secure. So I want to dive into red flags and indicators, and this isn't necessarily a checklist. These are just some things that if you see them, they kind of tick us off that something weird might be going on. This could be a human trafficking situation. So if this is trafficking, then there's going to be a trafficker who is trying to control your patient. They might demand to intervene. If you ask your patient for their documents, this person might have control over those documents or try to intercept any questions that you have. Maybe they say, oh, this person doesn't speak English. I'll translate for you. Be very cautious and try as much as possible to get an unbiased translator, someone who is not at the scene of the incident that you are responding to. Maybe the patient seems fearful or nervous or anxious with respect to this person, and maybe there is no person on site. Sometimes traffickers believe that their control over this person is so complete that they don't have to be on scene. But if your patient is looking scared, looking at their phone, frequently texting, you ask them a question and before they answer, they look on their phone and they text. that could be a sign that there is a trafficker located on site communicating with your patient. So in terms of environment, if there is an unusual amount of security, security cameras pointed inwards, locks on the outside of doors, barbed wire fencing facing in. These are all situations where the security is focused on the people who are inside working, as opposed to intruders who might be breaking into the property. Migration history, if you notice that somebody doesn't speak the language or appears to be a foreign national, then that could be a sign that they are being exploited, right? That coercion or control that we mentioned in the very beginning, any of those signs, control of documents, intercepting questions, threats, anything like that. And if the working conditions seem really unsafe, maybe you have responded to a construction site and people aren't wearing the proper protective equipment. If the working conditions seem unsafe or seem to be a violation of labor rights, that could be an indication of labor trafficking. And living conditions, if there are a lot of people living in a small space, and if hygiene seems to be an issue, maybe people aren't able to wash themselves or keep the place that they live clean, we have to wonder, why aren't they able to? Are they working such long hours that they aren't able to take care of themselves? A lot of times traffickers will withhold things like food, showers, basic necessities, just to establish that control and maybe to force them to work harder or maintain a quota. Now, physical things when examining your patient. And I know that a lot of these things, if you are on a call, these can be present in a lot of different situations. But again, we're looking for the larger context in which these physical symptoms appear. So if somebody is really tired, they're not getting enough sleep. If they appear malnourished, again, the trafficker might be not letting them take care of themselves, or they're not able to take care of themselves. Maybe you were called to a scene because somebody tried to conduct an abortion at home. And if part of your examination of your patient requires you examining the genital area, then things like STDs, genital trauma, anal trauma are likely an indicator of sex trafficking. Now, if there are signs of abuse, suspicious injuries, somebody has an injury and they can't explain how they got the injury, or they said that they got hurt at work, then we have to wonder how they got that injury. Tattoos or branding. So if you are seeing visible tattoos, and especially if you are seeing a number of the same tattoo appearing on people in the same geographic location, traffickers use branding as a way to, or use tattoos as a way of branding their victims as their property. So feel free to gently ask about your patient's tattoo. Ask them, oh, that's a cool tattoo. Where did you get that? And if they answer that they got it because they liked it, or they like diamonds or crowns or whatever the case may be. However, if they say, my boyfriend wanted me to get this, then that's definitely a red flag. If the clothing that they're wearing is inappropriate for the weather or the location, or they're not wearing the right protective equipment. If you get repeat calls to the same location or for the same patient, and you're seeing a lot of these suspicious injuries or this malnourishment, maybe this person is getting worse, or there's a condition that should have been easily treatable with preventative care, but they weren't able to get that preventative care. And if they use terms associated with the life, if they say, you know, oh, daddy's going to be mad at me, or the trick, John, stable, the track, the blade, these are all terms associated with the life, which is a term that someone uses who is involved in sex trafficking. to sort of normalize it. Then we have to wonder, why they're using those terms. So let's also look at behaviors and attitudes. So again, if somebody has been trafficked, then that means that they have undergone extreme trauma, and that is going to elicit certain behaviors. Somebody, maybe this patient is making your day really difficult. Maybe they aren't listening to your directions, or they aren't answering your questions. And that is not them trying to make your day difficult. That is the trauma intercepting how they interact with the world. So somebody could be really fearful or paranoid. Somebody could be scared of you, even though you were just trying to help them. They might exhibit overly promiscuous behavior, depression or anxiety. I know that in today's society, a lot of people suffer from these mental health issues. But again, we want to look at these in conjunction with the larger context. So hyperarousal or hypoarousal, somebody might be really hyper engaged and hyper vigilant, looking for things that could hurt them, but they might also be hypoaroused, so they might be flat or disengaged. There might be a huge gaping wound on them, but they're not even acknowledging it because they're so numb and desensitized because of the trauma. There might be substance abuse. Traffickers frequently, especially in sex trafficking, get their victims addicted to drugs to really numb the trauma of what they are going through, and as another mechanism to maintain control over them. This person might express a need to pay off a debt. Maybe they are in the back of your truck or your rig, and they say, I can't stay here. I can't go to the hospital. I have to get back to work. I have to pay off a debt. And if somebody is so scared about their employer or about this debt that they don't want medical treatment that they clearly need, then that is a huge red flag that they are being exploited. So I want to talk more about interaction with your patients. So say you notice some of these red flags and you think that this could be trafficking. It's really important to ensure the safety of yourself and your patient. Hopefully you have police responders on scene that are familiar with trafficking, and you can let them know about your suspicions and about who you suspect the trafficker might be. If you can, try to separate the suspected victim from their trafficker. Try to make up an excuse, say, oh, for this part, we really need them on the rig, or we need to ask them these questions in private. This is protocol. Because you might get one story from the trafficker, and then once you get your patient alone, they might be able to tell you a little bit more about their situation or ask for help or resources. I know that time is really of the essence in a lot of these situations, but whenever possible, be gentle with your patient and ask open-ended questions. Again, do not involve the trafficker in that medical consultation. And be really open to what your patient has to say. If they mention, oh yeah, I got this gash in my side because a John stabbed me or something like that, and you react to that, they might internalize that as shame or as you judging them, even if you are reacting to how horrific their story was. So really try to be calm and non-judgmental in whatever your patient tells you, and that will help them to trust you a little bit more. And maximize the effect of that encounter. So it's possible that your patient does not want to seek further medical attention. They don't want to leave. They don't want to go to the hospital. So try to maximize that effect. Let them know that, don't ever make promises, but let them know that there are resources available to them. And don't press them into giving you information about them or their trafficking situation. So a quick word on trauma-informed care, and if you haven't, I highly recommend finding more information about trauma-informed care. This is really brief, just touching the surface. But trauma manifests in different ways, right? Somebody could be in fight or in flight mode. Don't ask them to retell their story because that can re-traumatize them. Let the patient share only what they feel comfortable sharing. Don't press them for details. Don't press them about what happened. Ask them only what's necessary to determine the next steps and establish trust, and be patient with them. And give them control wherever possible. Ask them if they want to go to the hospital. And even if they really kind of need to go, it's important for you to give them that choice whenever possible. They don't have control over their situation, so if you give them control, that's really powerful. And explain the process. Let them know, okay, you are suffering from, a lot of bleeding or whatever the case may be. We are going to take you to the hospital, and there they're going to be able to take care of you. As much as you can, explain the process so they know what's happening. So here are some examples of really quick questions that you can ask. Again, I know that in some scenes, you really have to make split-second decisions that can save somebody's life. And there isn't necessarily time to really sit down and interview your patient. But just some quick questions that you can ask. Are you safe here? That's a huge one. Can we take you to the hospital? Would you like to go to the hospital? If you do have time to sort of sit down with your patient and find out more information, tell me about this person that you suspect might be the trafficker. Is this your boyfriend? How did you two meet? Or is there someone that we can contact for you? Maybe this person is a minor and they want to get in contact with their family. And do you know where your documents are? If they say that their trafficker has their documents, that is a huge red flag. So these resources are local to the Houston area. For those of you who are outside of the Houston area, please go to Polaris Project. I believe it's called a social services referral or directory, and they have resources for all over the country that have really similar goals for this. And that way you can have, if your patient isn't ready to go to the hospital, then you at least have some numbers and resources that you can offer them so that they know there is support waiting for them on the other side once they're willing to take that leap. So here in Houston, we have an amazing organization called Rescue Houston that is a 24/7 hotline. So if somebody wants to leave their trafficking situation immediately, they call that hotline anytime, and somebody will come to pick them up within 1 or 2 hours. So this is an amazing resource that we have, and I know that not all cities and states have a program like this, but if you are interested in finding out more, please feel free to reach out to me and I can connect you with them. The Landing is a drop-in center off of Bissonnet, which here in Houston is known as the Track, or a hub for sex trafficking. And this is a drop-in center where people can drop in at any time just for services, a place to rest, a place to sleep, some snacks, and no pressure. They can come in anytime, but once they are ready to leave that life, then the Landing also does case management. And on the topic of case management, we have YMCA International and Catholic Charities who specialize in addressing the unique case management needs for survivors and victims of trafficking. And they are especially well versed in supporting foreign national victims of human trafficking, so they know how to navigate applying for a T visa or a U visa, helping with citizenship documents, translation, and other resources that population needs. We have a few long-term wraparound recovery programs out here in Houston, and one of them is Redeemed Ministries. So again, we don't want to make promises to victims. We don't want to say, you're going to be okay. Unfortunately, these resources do fill up. These, the case management load and the long-term wraparound services, but we want to be connecting people with these resources if they are ready to take advantage of them. Okay, so I want to speak really quickly about reporting, and I have about 7 minutes left until I want to go into questions, so I'm going to be really quick in this section. So, full disclosure, I have never filled out a medical report. I've never seen one, but in my research, I found that it's really important to include suspicions of human trafficking in that medical report. And the reason for that is if you are able to transfer that person to the hospital, then the hospital will, a lot of hospitals have protocols for responding to human trafficking. So if it's at all possible, if there are specific hospitals that you work with your ambulance or within your county, talk to them ahead of time about what their human trafficking protocol is and what they would like from you in order to facilitate helping those patients that you suspect are being trafficked. So if maybe that person refuses medical care or refuses to go to the hospital, but if you receive multiple calls for that same patient or that same location, then the next team that responds to those calls can look at the report that you filled out last time, look at your suspicions of human trafficking and see, okay, this place that we're going to, the last team thought that this could be trafficking. So let's use that information to try to ask the right questions and get them connected to resources and see if we can separate the victim from their trafficker. Now, if your patient decides to pursue legal action against their trafficker, then that medical report can be really helpful evidence in actually getting that trafficker convicted. So when you're filling out your report, you want to note tangible facts, such as those red flags that we noted. So you want to note things like other person on scene was in control of documents or trying to intercept questions, or saw a tattoo that looked like it could be branding, or saw signs of mistreatment or abuse. Don't record things like speculation or summaries because those are not as effective for what we need from these medical reports. Now, if you use ICD-10 codes in your hospital system, I know that some counties do use these and some counties don't, but using ICD-10 codes is really helpful for those reasons that I mentioned before, as well as for data collection. Like I mentioned in the very beginning, data collection is really hard to come by due to the nature of this crime and the different ways that people record information. So using ICD-10 codes really helps us to collect reliable information on human trafficking so that we can use that research and evidence to really inform how we approach this work to best prevent exploitation and serve survivors. Now, this is the National Human Trafficking Hotline. So everybody take out your phones, and if you don't, please put this number in your phone. This is a 24-hour, 24/7 number, and there are a few different ways that it works. So somebody who is a victim of trafficking can call this number at any time to get help, to get resources. So if your patient does not want to leave or does not want to go to the hospital, then I highly recommend giving them this number so that, and there are ways to get it on small cards or on other hidden objects that they can have that number without their trafficker finding it and punishing them for it, which is a real fear for a lot of people. So they can utilize this number. In addition, this is not an emergency number. So you can call us at any time just to ask questions, or say you suspect human trafficking, but you are not sure. There's no penalty if you're wrong, and if you're right, then somebody can get help. So the way it works is you call them or you can text them at 233-733, and somebody will first ask if you are safe and then ask questions to determine if a report can be made or not. If a report can be made and it's recommended for law enforcement to get involved, then they will connect with the local law enforcement in your area that are specifically trained in investigating human trafficking. So the reason that we don't always want to call any law enforcement is because if they are not familiar with human trafficking, then it's possible that they can arrest somebody for prostitution when it's a case of sex trafficking, or have somebody deported if they are a foreign national. And somebody might have a real fear of law enforcement, and we want to respect our patients' wishes. So they'll only call law enforcement if that's the recommendation. So you can report a tip. You can also get resources. You can call this number and just ask them, what are services in my area? Or I saw this and I thought it was weird. Feel free to call them at any time. Now, for those who are service providers, you do have to adhere to HIPAA guidelines. That means that you need to get your patient's consent in order to call the hotline. So do ask for your patient's consent to call the hotline. Maybe if you can separate them from their trafficker, you can have them call from inside of your rig or your truck. If your patient does not give consent, then you cannot call the hotline with their personal information if they are over the age of 18. However, you can call the hotline to talk about patient or the trafficker, or you can give the hotline number to that individual for when they're ready. If somebody is under the age of 18, then they cannot give consent, right? So here in Texas, it is mandatory reporting to Texas Department of Family and Protective Services, and it's likely that you have a similar reporting protocol in your state. So do find out what those mandatory reporting requirements are and who the right agency is to report to. However, you can additionally make another call to the National Human Trafficking Hotline. Okay, so we are right on time. I want to leave you with our agency's contact information. So this is our general email and phone number inbox. Please feel free to follow us on social media. If you have any questions about our programs or about our response here in Houston to cases of human trafficking, feel free to reach out to me. Everybody should have received my direct email because you registered for this webinar. Okay, so I'm going to go into the questions now, and if you have any questions, feel free to enter them, and if you and then I will answer them. So I got one question. When it comes to medical reports within my department, we can't see previous reports besides name and medical history. Would you suggest putting suspected trafficking in maybe the history section, the portion that will get brought up? Okay, thank you so much for submitting this, because like I mentioned, I haven't seen a medical report before, and I was just going off of my research. So you're saying that somebody who is responding can't necessarily see the full report. So suggest putting it in the medical history. Yes, I definitely would say so, especially if the observations that you're making are related to their medical history. So for instance, if there was something that should have been able to be treated with preventative care, but it wasn't, that can go in the medical history. Yes, I would definitely recommend putting it in the medical history so that somebody can, who is following up on that call, can respond appropriately. And I don't have any more questions yet, so I just wanted to mention something that I didn't have time to go over, and that is protocol. So it's really helpful to establish a protocol with people who are in your responding organization, so that if you suspect human trafficking, you've already talked about protocol, you've already worked that over with your team. So protocol can look like calling somebody on your team who is especially well versed in human trafficking. We've also seen some agencies have calling cards or like special cards that help with self-identification or that have resources or the human trafficking hotline on it that they can automatically give to their patients. The protocol can also involve speaking with law enforcement to make sure that they are well versed in trafficking and trained in what to do and how to respond to victims appropriately. It can also look like establishing a connection with the hospital and with enacting their anti-trafficking protocols. So as far as next steps go, how to really implement this information into your organization, I really recommend enacting a protocol. And if you would like help in what that protocol looks like, again, feel free to reach out to me. Okay, so it looks like I don't have any more questions. So I do want to use the last 5 minutes that I have to share some more information. So Texas, what is the second highest for reported cases of human trafficking, California being number 1, and Houston has the number 1 reported cases of human trafficking. So we've really taken that as an opportunity to build out our anti-trafficking network and really involve as many stakeholders as possible in the fight against human trafficking. So, you know, in the midst of social distancing, even though a lot of us might be going a little bit crazy staying at home, I think that it's a really great opportunity for all of us working in different agencies and sectors and organizations, different cities and different states to get information and learn from each other and reach out to other people who might have insight on a new way to run a program or to deal with a problem. So I want to thank all of you for being on this call today. Thank you for sharing your time with me and listening to this information. I really appreciate it. And if you have any more questions, please feel free to reach out to me. And with that being said, enjoy the rest of your day. Thank you again.